for patience. Why I keep talking about dental, people have been asking me why I keep talking about it. And if you want to know why I keep talking about it, or why this is the most important video, right? I didn't just wake up someday crazy about dental. I did do another video, by the way, that is for dentists, but really this is for us all, right? Because even dentists have teeth and they don't want to be patients. But if they are patients, they don't want to pay the bill. So if you're watching this video, just know that health starts from the mouth. Nothing to buy here today. Completely educational. This is information that I wish I knew 5 years ago or more. I lost my dad 5 years ago. He was just 62. And if I knew this information, I knew he would still be here today. I'm quite positive of it. So let's get right into it. All right, where should we begin? Let's start right at the top. So health is from head to toe. This is the number one concept that we need to understand. Our body, and I don't mean any of this arrogantly. This might seem like it's, common knowledge, or it may seem like it's something everybody already knows. And I really hope everybody does know all of this information. It is public knowledge. It is information we should all know. But I'm not going to make any assumptions. It's just, I really wish somebody had organized this sheet for me and had given me this information 5-6 years ago. It would have saved my father's life and many, many other people's lives. So I'm going to share this with you in hopes that it can save somebody some time, money, and definitely some pain and headache when it comes to navigating the healthcare system. So here we go. Health is from head to toe, and you just simply cannot have a healthy body without a healthy mouth. Okay. Medicare and medical insurance will help, but you have to know how to talk about it. If you go and ask medical or Medicare for dental help in the mouth, they're going to deny you, saying you should go sign up for the Advantage plan or find a dentist that takes it, and then you're just back to square one. But if you ask for the medical help for your mouth, I know that sounds like the same thing, but we live in this real weird world where we use dental as a dirty word. Just in this world, just think of dental as a dirty word. It's a 6-letter word that starts with D and ends with L, and you should never use it when you talk to a medical or Medicare company, in trying to get your health. And same thing with the dentist. Some of the dentists, actually 99%, most of them don't know this stuff. I'm creating a free summit, by the way, so I'm inviting a bunch of dentists to teach them so you don't have to say it for them. We taught a lot of patients to teach their dentist and to help them get on board. But as you can see, that there's this big telephone game that happens, and it's just much easier for me to make this video or somebody, to just make this video, and nobody really did it. So after 5 years, I'm making this video, by the way. So if you have any feedback on how to make this better, let me know. I'm all ears. We just want to make sure that we all understand the same things, though. The most important thing is, because health is from head to toe, and we all know that the mouth is part of the body, we need to take charge, because the system is out there. We have the dental system, we have the medical system, and there's an overlapping part of it. But as the patient, for us to have our health insurance or have our Medicare pay for the work that we need in our body, we need to be the commanders of our own ship. So 9 out of 10 people, by the way, when they do take charge of their own mouth, they start to feel better and they take less medication, because what they're finding is that once you get the infection removed out of your mouth, which is 9 out of 10 cases is the primary infection spot or the cause of other infections or diseases in the body. So meaning, if you just get rid of that dying part of you or the decaying part of you, right? And it's usually from like foreign foods or something that you ate that just wasn't brushed out. It starts off with something small like that, or some sugar, or maybe even traumatic, like a puncture in your mouth. Maybe you got cut. I mean, it could be a whole bunch of reasons, right? I'm not the dentist. You should see one or ask one of our health planners, that works with dentists all the time. And that's the thing, is most people don't know because they go to a hospital or they go to a doctor. But now with our current healthcare system, especially in the US, about 9 out of 10 times, I can say you're better off skipping the doctor and visiting a dentist, but not just any dentist, right? There's a lot of dentists that don't really think the body is connected. They just treat the teeth like dead bones, which we clearly know is not the case anymore. So make sure you go to a smart dentist. Make sure you go to a dentist that understands, more than just trying to make money, right? We'll have other videos for it. I can't get into all of that here, but I'll make sure to make a video, and it'll be free. It'll be on the YouTube and other channels that I have out there, just so we make sure that you have this information. You shouldn't have to pay for this stuff because it's related to your health, and all the resources are already out there. It's all free information, in fact, but there's just too much unuseful information. I mean, goodness, all you have to do is open TikTok and just spend, mindless hours, melting your brain away. But anyway, I don't mean to digress. So, okay, important information, part number 4, I think. Dental is medical. And this is the most interesting part, because we can go to a hospital today, or our doctors, and they aren't taught dental, or they specialize. Let's use that word. They specialize in different areas of the body, and this is great, as far as getting a license and to do research and to get really good at one thing. But this is horrible in practice, especially at scale. I mean, think about it. Let's just use this example specifically. We don't even need to make an analogy out of this. Dentists need to learn the specialized skills to fix teeth, to remove teeth, and then to replace them. It is the most complex part of the body. We have blood, saliva, soft tissue, hard tissue, bone, teeth, enamel. Like it's literally the most complex part, even more than brain surgery, because it's more interconnected, and even more than heart surgery. When we really get down to it, dental surgery is the most valuable and complex surgery that any doctor can do on a human body. Yet, they're the most underpaid here in the US. And that's what I'm here to change. It's not because I just want a bunch of dentists to get rich or want to just make a bunch of dentists money. It's because the system is there, and we're already paying too many people too much money for a poor result, right? The reason why I say that is because right now, we spend 2.5 times more per person in this country, and we outspend, I think, the next 8 or 11 countries behind us, yet we rank 35th, 36th in the world as far as countries go, which means we do worse with all the money that we're spending, all the technology, all of these machines, devices, doctors, and nurses. Shortage or overrun or not, it doesn't matter. The fact is, we have 34 or 35 countries doing better than us. I'm not even going to pretend to. Yeah, I don't even know what to say to that. That is just so bass-ackwards and so Twilight Zone that the only possible solution for this entire healthcare system, it's really very simple. This is the only thing I've been thinking about for the last 5 years, and the more I think about it, I only become more sure. We just need to treat the mouth as part of the body. We need to stop treating people for heart disease, breast cancer, mental illness, diabetes, high blood pressure, cholesterol, arthritis, any of this other stuff. We need to first look at the whole body. We can't just look at arthritis and say, oh my gosh, there is a problem with that joint. Let's attack that joint or the problems of that joint only. We should look at the problem. Like if a patient presents themselves and they say they have a problem, whether it's in the mouth or it's in the fingertip, they should understand why they came, and they should also look at the rest of the body and see if there is a potential cause of that source. That cause of that pain, the source of that pain that is not yet seen or not yet known. And many times it is. Most infection or most disease in the body, and especially in the mouth, is just it's uncaught. It's left untreated and it's left undiagnosed. So it wasn't undiagnosed heart disease for my dad. It was undiagnosed jaw infection, right? Which is a true, actual thing going on. It was infected. And he had 2 root canals, which that was the actual source of it all. So it was left untreated. So health is not some mysterious target. It's not some magical potion where you have to take a concoction of pills and a cocktail of juices and you have to have a very special diet. In fact, the simplest foods, and they can taste good. Don't let anybody tell you they don't. It's just healthy foods, good clean water. And we're going to make other videos, by the way. I'm just realizing I can keep going on and I'm trying to stay on topic as much as possible, just to give you the fundamentals here, that you just want to understand that health is from head to toe. You just can't have it otherwise. And in most cases right now, it is the mouth. We know dental is medical, even if the insurance companies or some rule book tries to tell us it's not. We know the mouth is part of the body, so don't let anybody tell you otherwise. I do just want to let you know that if you don't already know, you can bill. It is your money. So when it comes to insurance, when it comes to Medicare, I know a lot of hospitals and a lot of dental offices, they offer a service of helping get your money. Service, right? They help to take your money, basically. But this is something that you can do too. And the benefit of doing it is that you can get the money first and you can choose any dentist or doctor that you want to go to. So actually a lot of patients are starting to do this now because they're realizing they can get the money up front. Sometimes they can get checks to see a dentist. We just helped another patient. They're going to get I think about $3,500 actually. And so instead of paying for, a surgery or paying to get like an implant out of your pocket, you can visit one of our health planners and they can get you a check. So at least the surgery can be covered. And we're also working with a lab to get the restorative as well. And so that's coming. The restorative is like the hardware, like the replacement tooth or the crown. So be sure to stay tuned for that. It can and it should. I mean, we've done it before. We're just we're implementing a system and we're fine-tuning it so patients can just get help easier. And I guess the last thing here on this side is the disease. So I mentioned that 70% of all heart disease and breast cancer starts from the mouth, but I just want to leave with saying most people that are sick, like it wasn't just my dad, this is 70% of everybody everywhere, but especially in the US. Because other countries, they do cover dental. Some of them have very outstanding and advanced medical programs that integrate healthy options. So like there are, for example, like in Europe, they're doing ozone therapy and they've been doing it for, decades. In the US, we're just now starting to make that more available, which is, it just doesn't make sense to me. Only if you wanted to make money off of higher profit stuff. Like it has to do with business and branding. It doesn't belong in healthcare. So I'm going to help navigate that. I've done a lot of startups and a lot of business navigating. So for me, I guess this isn't really easy for anybody, even for people that work at Medicare and the federal government and all these health insurance companies. I'm sure they're just as confused too, because this stuff isn't designed to be easy. They created a system to direct a lot of money to try to make it easier to deliver healthcare. But the biggest thing is you're not going to have any healthcare if we don't cover the mouth. So I'll just end with that one on this. We'll be doing a live series where, we'll share it live, but we'll be doing a recorded series that you'll be able to access as a patient. If you're a dentist seeing this video and you stayed on till this long, kudos to you. You're definitely the kind of dentist that we want on our program and our network, because we have hundreds of patients already and thousands that are just reaching out to us every day, asking us for a dentist in their area. And if you're a patient and you think your dentist doesn't take Medicare or has already denied your Medicare card, show them, well, this video, or I had another one talking more to dentists, but either way, just let them know that it is possible. And you don't have to do it in an arrogant way, and we don't have to do it in a challenging way. We just want to do it in a friendly way, and in a way that we're just asking for help, because that's what the dentists are here to do. They want to help their patients, and most of the dentists I meet are incredible people. So, all you got to do is ask. Most of the times I worked at a front dental office. The reason why we didn't do it, by the way, is just because we were never taught. And even if you ask like 3 or 4 dental offices and they all say no, don't worry. That's just because that's the reality of the situation right now. 99% by statistic of dental practices, they aren't registered. And that's the reason why they can't accept Medicare and medical, by the way. It's not because they're not able to. I mean, if they're able to treat you, like if they're licensed, if they have a active license hanging in their door or in their building, and they're an active doctor, they can and they should be able to accept Medicare. And it really, to speak to the patients real quick, I'll just say this one thing. It just came to mind. A lot of patients don't understand why it's so hard for them to find a good doctor, and it's similar to medical. Like, we have insurance companies. I know most of us, we understand that, and this is not the video to explain insurance, but with dental, a lot of insurance companies pay out a very small amount to dentists in dental insurance. So dentists have gotten a very bad experience with insurance. But it doesn't mean that they can't take Medicare or medical. They just think, or many of them, without even trying, they just have heard that it's very hard. So again, doesn't mean that's not possible. We've done it for a couple hundred, going on several hundred dentists now all across the nation. We haven't seen a single state that it doesn't work in yet. And we're getting dentists paid for their work and patients covered. We're getting patients options, and we're helping patients get like a second opinion. Sometimes they can't travel to a dentist. And so I will make another video about this, because this is quite important. I'm really excited about what we're going to be launching here. Is we're able to provide help for the first time. Yes, from a dentist, but I think more important than a dentist is having access to a health planner. Just like a hospital, right? It's cool to talk to a doctor, but even talking to a doctor, like this whole telehealth thing and teledentistry, we're doing one better, and I'll tell you why. Of course you could talk to a dentist. We have access to that too. But what we're doing uniquely different than anybody else is you'll actually have access to one of our top trained and experienced dental professionals. Because the little insider secret that I'll tell you, and I know this video is getting a little long, so I'm going to actually just stop with this here, is it doesn't make sense to go to a doctor. You want like a triage nurse. You want someone that's experienced, that's kind of like your best friend, and that can give you all of the insights, because they're not really looking to make money off of you, or they're already your friend. So they want to give you the best recommendation. So that's what it's about. It's about getting and understanding your oral health, your best options, what treatment you should even be getting, and like what are the prices and ranges you should be shopping for, and ultimately, if Medicare or medical will cover it, like how to get it covered, or one of our health planners will actually do it for you. But that's what it's about. So make sure that you follow along. We have our YouTube channel. It's Health Starts From Mouth Movement. That's what this stands for, and it's probably not the easiest thing to remember, but HSFM MVMT. And we'll see you on the next video.